Today, we'll be looking at easy way to remember NCLEX lab values. And as usual, we'll start with a quiz. The nurse cares for a client who is pale and frequently reports fatigue, weakness, and dizziness. Which serum lab test result is a nurse's priority for planning care? So again, this underscores the reason why you must know your lab values. You must know what your hematocrit levels are. You must know what your sodium normal levels are, your potassium, and your hemoglobin. Because I know mine, I know the correct answer would be option 4. But again, I'm going to put you through on how you can easily memorize your lab values. And we'll start with our CBC. First would be hemoglobin. One way to remember that is, hemoglobin, as you can see, is divided into females and males. And you always want to remember that females mature quicker than males. They mature earlier than males. And this happens particularly between the ages of 12 and 16. So again, you can see they mature earlier from the ages of 12 to 16, while males mature a lot later, from between 14 to 18. So again, this one way to remember it for hemoglobin. Females mature earlier or quicker than the males, from between 12 to 16 years, and for males from 14 to 18. That's one way to remember that. For your hematocrit, remember hematocrit measures the proportion of red blood cells in the blood. And how do you easily remember your hematocrit level? Very simple. All you need to do is to times your hemoglobin by 3. So we want to times our hemoglobin values by 3. And if you do the maths, 3 times 12 should give you 36. You also multiply the lower levels or the lower range, it should give you 48. And males, if you times these hemoglobin values by 3, you should get a value of between 42 to 54. That's one easy way to remember your hematocrit level. And how about your red blood cells? Again, when you think about red blood cells, I want you to think about blood. Think about the human body, think about blood. And again, you remember that the human body has approximately 4.5 to 5.5 liters of blood. So again, red blood cell tells me about the blood, the human body, and I know the human body or the adult human body has approximately 4.5 to 5.5 liters of blood. And this actually correlates perfectly with the normal range for our red blood cell, which is what? 4.5 to 5.0 or 5.5, still a range. Okay, so you can see in the male is 4.5 to 5.5. So that's one easy way to remember your RBCs. And how about your WBCs? Again, one way I remember my white blood cells count, my normal white blood cell count, is to look at the first alphabets, W, B, C. And I tell myself, want to buy a car? You want to buy a car? And if you want to buy a car, you at least need to hold between $5,000 to $10,000. So again, that is your normal range for your WBC. So the first alphabet reminds me of WBC, white blood cell, want to buy a car. So that reminds me, that acronym reminds me of what the value should be, between $5,000 to $10,000. And with our platelets, I want you, when you're trying to figure out your normal platelet counts, remember these are your thrombocytes. You want to think of platelets, you want to think about the word plate. So plates. And again, remember, these fine China plate sets cost between $150 to about $400 on an average. So again, think about plates, and we remember that fine China plate sets cost between $150 or $100 to about $450. So again, it gives you a range of your platelet counts when you remember plates and what it costs in the market. So that's one way to remember your CBC panel. If we go to our BMP or your basic metabolic panel, your blood chemistry, how do you remember your calcium, your normal calcium values? CAL, call. What do I need to call? 911. I need to call 911. So that call reminds me to call 911. And again, you want to remember that this value might range depending on the facility by 0.5 milligram per DL. So again, instead of having 9 to 11, because we said it could vary depending on the facility by 0.5 milligram, I can take out 0.5 milligram here, and this becomes 8.5, and this becomes what, 10.5. So again, one way to remember this is to call 911. How about our sodium? What's it? One quick way to remember your sodium values? Again, with the sodium, you want to use the OD here to remind you of odd sodium. So that OD, the letter OD in sodium reminds me of odd numbers. What are my odd numbers? 1 is an odd number, 3 is an odd number, 5 is an odd number. And that's the lower range, your normal lower range for sodium, 135. So all I need to do is to add a 10, and I should get 145. So that's one way to remember sodium. The OD there reminds me of odd numbers, and my odd numbers are 1, 3, and 5. With potassium, remember one source of potassium would be your bananas. And again, if you want to buy bananas, they usually come in a bunch of 3 to 5 bananas. So you can see this one is in a bunch of 5. You can also see them in a bunch of 3. So that gives me an idea that this is what my normal potassium level to be. So potassium reminds me of bananas. And again, when we want to buy these bananas, we want to buy them half ripe. So you want them to be half ripe, and that half is what I'm going to put just beside my 3. So my normal potassium values would be 3.5 to 5. So again, potassium reminds you of banana. Bananas come in a bunch of 3 to 5 fingers. And again, you want them to be half ripe. So that's your normal potassium level. With our chloride, I want you to think of chlorinated pool. You can see the man is pouring chlorine into the pool. And again, if it's super hot, outside, then you might want to calm down in the pool. You might want to sit or take a swim in a chlorinated pool. And when we're talking of super hot, I mean like temperatures between 95 to 105. So again, if it's super hot, chlorine here reminds me of a chlorinated pool. And if I have these high temperatures, then I want to take a dive in the pool. So that's one way to remember your chlorine with the temperature values. So again, chlorine reminds me of a chlorinated pool. And if it's super hot at about 95 to 105 Fahrenheit, then I want to go for a swim in a chlorinated pool. With magnesium, mag here tells me magnifying glasses, magnifying. And again, when you think of magnifying glass, it lets you see things they make items to be bigger. They magnify your items. So it magnifies them up to 1.5 to 2.5 times bigger. So that's what your magnifying lens does for you. It makes items to become 1.5 to 2.5 times bigger than what they normally should look like without the magnifying lens. So that's one way to remember magnesium. Mag here tells me magnifying glass, and you can see what this text looks like, and you can see how it's been magnified up to 1.5 to 2.5 times bigger. So that's one way to remember your magnesium level. With our BUN, I want you to think about your hamburger buns, or in Nigeria here, we'll call them buns. And normally these buns, that's what it looks like. They are sold between 10 to 20 Naira. So that's one way to remember your buns. You can even get them as low as 5, but again, keep it at one figure. So usually they are sold at between 10 to 20 Naira. So that's how you remember your BUN level. Okay, how about creatinine? What's one way to remember your creatinine level? Create here tells me, create, you're producing something. I remember when God created the earth, And he actually started from 0, and it took him 7 days to create the earth. So I'm going to put a dot there, and I put 7. So it took God to start from 0 day, and it took him 7 days to create the earth. So again, once I have that starting number, all I need to do is to multiply that, and I get 1.4 as the higher order. So that's your normal creatinine level. So you want to remember create, and it took God 1, 2, 3, 4. It took him 7 days to create the earth. So went from 0 to 7, so 0.7, and I multiplied that, and I double that, and it gives me 1.4. So that's your creatinine level. To remember your glucose level, when you think of glucose, glucose gives you that energy. And again, remember, you're very energetic in your youth, but our energy starts to decline in the elderly years, especially once you start hitting those years like 70, you start getting less energetic, less energy, less glucose. So that's the range when you see that less energy in individuals from those age ranges of 70 to 100 years. So that's your normal level for glucose. So think about glucose, think about energy, think about how we tend to become less energetic when we hit these age ranges of 70 to 100. Okay, so how about your HbA1c? Remember, your hemoglobin A1c measures the amount of blood sugar levels in the past 3 months. So again, you want to remember that this measures your blood level in the past 3 months. So once you remember that, you know that it measures the blood level in the past 3 months, all I need you to do is to write out, continue numbering from 3, we go to 4, we go to 5, and we go to 6. So it's almost like we want to use this to remember our starting point. So again, once you have that, I want you to remember that the normal ranges of your HbA1c would be between 4 to 5.6. So I'm going to put a dot here. So this is 4, so this is a dot, and this is a hyphen. So the normal ranges for your HbA1c is between 4 and 5.6. So again, remember, HbA1c measures the amount of blood sugar levels in the past 3 months. So once you have that 3, that's a reminder to say, I'm going to count forward. So 4, 5, 6. So all you need to do is to separate them. So we have the ranges, the normal ranges from 4 to 5.6. So that's our normal HbA1c. With our phosphorus, one easy way to remember phosphorus, the 4 here, 4, almost sounding like a letter 4. And us is talking about 2 of us, both of us, me and you. So that's 2 people. So I'm going to put 2 here. And again, the normal ranges for your phosphorus is between 2 to 4. So that's a guide to remember. And again, usually there's going to be the 0.5 beside it. So I'm going to put my 0.5 there. I'm going to put my 0.5 there. So normal ranges for phosphorus will be between 2.5 to 4.5. Again, you want to remember this with your 4 sounding like a 4 and us sounding like both of us, 2 of us. With our urine specific gravity, what's one easy way to remember it? Well, I know that the hot morning sun comes out at about 10:30 a.m. So back here in Nigeria, the hot sun starts to shine at about 10:30 a.m. So that's one way to remember when the sun, you have the sun very hot, you tend to get hot, you tend to get dehydrated. So that reminds me that my urine specific gravity, any levels greater than, this is my 1030, but I'm just going to move the decimal to 1.030. So it's still the same 1030, only that I've moved my decimal point back. So again, any levels greater than 1.030 tells me my client is dehydrated. So that should be your normal levels, anything less than 1.030. So if it's greater than 1.030, your client is dehydrated. Again, normally your normal range should be between 1.010 to 1.030. With our coagulation studies, measured in seconds, you want to think about your prothrombin time. Prothrombin time, so PT. So this reminds me of the preteen years, teenager years, the pre-teenage years, and that's usually between 10 to 15 years. So, okay, if we put our seconds, this tells me my normal prothrombin time. Or again, you can use the T in the PT to remember 10. Okay, so you can use this to remember 10. So this will tell you it's between 10 to 15 seconds. With our partial thromboplastin time, remember your partial thromboplastin time helps assess the body's ability to form blood clots. And the normal range is usually between 30 to 40 seconds. So again, how do you want to remember this normal range? We said you can use the T to remember 10. So T stands for 10. And then we can use the second T to remember what? 20. And we know that we are going to what? 30. So this is 10, 20, then you move to 30. And that is what the normal range should be, 30 to 40 seconds. So again, you want to use this as a guide. You see PTT, and I know one T represents 10, another T represents 20, and I'm going to 30. Going to the next figure, which is 30, and then the next one, 40. So it's almost like you're counting in tens, 10, 20, and then I write 30, and then I write 40. So again, that's your normal range for your partial thromboplastin time. Again, you want to remember that if the patient is on heparin therapy, we also want to monitor PTT to see if it's therapeutic. And in this case, the normal PTT should be 1.5 to 2 times our normal PTT. So again, if your client is on heparin therapy, you need to monitor the PTT to know if it's therapeutic. And if it's therapeutic, it should be at least 1.5 to 2 times the normal PTT. So most times you're looking at a range of between 60 to 100 seconds. Again, another trick to remember that we need to monitor clients on heparin, we need to monitor their PTT level, is to look at the TT here. If you put a little line there, it's almost looking like a H. Again, so the TT, if we put a line there, it looks like a H. And then the P, so if we put this, so this is our H here, and all I need to do is to bring the P forward. So this tells me heparin. So again, remember, clients on heparin needs to have their PTT monitored. How do you remember this? Put a line on the H, on the TT, it forms a H. And if you look at it the other way around, it tells you HP, which is heparin. With our international normalized ratio, what's our normal value? Well, it should be less than 1. So again, the I here, I change that to 1. So I write 1 and R. And this 1 here reminds me an INR of 1 or below is considered normal in a healthy individual. So again, use that first alphabet. Instead of an I, we look at it as a 1. And we know that we want to see 1 or below in our patient. So that's how one way to remember your INR. With your arterial blood gas, you want to have a starting point. Everybody needs to know this. You need to just memorize this, that your normal pH should be between 7.35 to 7.45. So once you have this as a starting point, you are able to get what these other ones are. With your partial pressure of CO2. So all you need to do is to use the decimal numbers in the pH range. So what I'm going to do for my PaCO2, I'm just going to bring this down here. I'm going to bring the 45 down here. So my normal PaCO2 is just 35 to 45. So that's one way to remember that. So you just need to take the decimal numbers in the pH to get your values for your partial pressure of CO2. Without bicarbonate or your HCO3, when you think of bicarbonate, I want you to think of a carbonated drink. Okay, so you see that carbonate there. So you're thinking of a carbonated drink like your soda or your Coke. And remember, when you have a pack of Coke like this, it comes in a pack of 12. And again, because it says buy here tells me 2. So it's almost like telling me 2 times that 12 pack. And this will give me what? 24. So this is just one way to remember it, okay? Because I know that if I go back by 2 this way, I'm going to get 22. And if I add 2 this way, I'm going to get what? 26. And that's your normal value for your bicarbonate, 22 to 26. So again, we said I want you to, carbonate should remind you of carbonated drinks like your soda, and it comes in a pack of 12. And the bi reminds you to do what? To multiply that by 2, and it gives you 24. So both ways, take out 2, add 2, and it will give you between 22 to 26. That's your normal bicarbonate level. So again, you want to always use that on your test. With our cholesterol levels, okay, this is quite simple. For me, I just look at this and I say, this C, if I turn it the other way around, I can form a 2. And there's a 0 here, there's a 0 here. So it tells me my cholesterol level should be less than 200. The same thing with my triglycerides. I know it has the same level with my cholesterol level, so I'm also going to put the same 200 over here. Your low density lipoprotein, okay? So you can see from the figure, you want it low, so it's going down, or it's going to lower you to the ground. So you want it to be at least less than 130 milligram per DL. So low tells you it must be going down. Good means down, it has to be down. If not, it's going to lower you to the ground. While the H tells you you want it high, so it should be going up. So again, you want levels above 45 milligrams per DL. So that's one way to remember it. The high tells you we want this value high. Your HDL value needs to be high, while the L in the LDL tells you we want the value to be dropping, we want it low, so it should be less than 130 milligram per DL. With your albumin, remember albumin is a protein produced by the liver. So what's our normal range? Again, when you think of albumin, remember we said it's a protein that's produced by the liver. So when you think of albumin, you want to think of a protein or a protein shake. So you can see what our protein shake looks like here. And again, when you want to make a protein shake, you need a minimum of between 3 to 5 ingredients to make a protein shake, especially if it's a homemade one. So again, this will help us remember what our albumin levels should be. Again, remember we said we need at least 3 to 5 ingredients to make a protein shake. So again, just remember to put your 0.5, so 3.5 to 5.5. So that's your normal albumin level. It's almost like close to your potassium level. So again, your albumin 3.5 to 5.5. You want to remember albumin is a protein produced by the liver, and you need at least 3 to 5 ingredients to make your protein shake. With your aspartate aminotransferase, your AST, and your alanine aminotransferase, that's also your ALT. But again, these are also 2 hepatic enzymes that are measured in a liver function panel, and the way to differentiate them is the S that I've underlined and also the L that I've underlined. And again, for your AST, the normal ranges is between 9 to 40. What's the trick to remember this? Okay, so want to use the S here and think about school. And what's an average school day? What's the time duration for an average school day? Normally, school starts at 9 a.m. and they should be closed by 4 p.m. So I'm going to write 9, put my hyphen, and put 4. Again, this is just a guide to remind you that the normal levels are between 9 to 40. So that's what our normal level is, between 9 to 40. Again, you want to use the S as a guide to remember school. And again, the average school day is between 9 to 4 p.m. So again, just remember to put your 0. So that's our normal school time. And again, with your ALT, you want to use L for labor, almost like walk. So again, that should also give you a guide of what your normal should be, because an average work day is actually longer than a school day, and it may begin as early as 7 a.m. and most times can close as late as 6 p.m. So again, that gives you a range, and we need to put our 0 back here. And that tells me my ALT should be between 7 to 60. How about our bilirubin level? Again, this is actually part of our liver function test, and our bilirubin level should be less than 1 milligram per dl. Again, how do you want to remember that? Reuben. So this almost sounds like Reuben. And again, remember when you order a Reuben sandwich, so this is what a Reuben sandwich should look like. When you order a Reuben sandwich at a restaurant, you usually get just one sandwich. Again, so this will remind you that your normal value should be less than 1 milligram per dl. So that's how you want to remember your bilirubin. So Reuben sounds a lot like your Reuben sandwich. And when you order a Reuben sandwich at a restaurant, you just get one sandwich. With our C-reactive protein, again, just like we talked about our Reuben sandwich, your C-reactive protein should also be less than 1.0 milligram per dl. So that's your normal value for your C-reactive protein. How about our erythrocyte sedimentation rate? Just like the name sounds, you want to stand it. Put the blood in a tube and let it stand for 1 hour, and you want to see how fast the erythrocytes sediment. So you can see it's going to sediment and drop, and that's what we want to measure, from the level where it was at the start to the level where it has dropped. And again, when you remember that, it tells you you want to see an erythrocyte or your ESR of less than 20 millimeters per hour. So again, just remembering what the process is, you keep a blood standing and you want to see how much it drops, and the normal rate should be at least 20 millimeters per hour. So remember, this is calculated after an hour. And your GFR, if remember my glomerular filtration rate, I always just draw my line and I label this 0 and I label this 120. If I'm able to remember this, I know I have one line that goes this way and I can put that 90. So again, if I add 30 or if I take off 30 from 120, it gives me 90. So that's what your range should be, between 90 and 120 mils per minute. So that's how you want to remember your GFR. In terms of therapeutic drug levels you need to know for the NCLEX, I try to remember this by grouping them, because I know that all of this, so I just group them as P, V, T, and I just put a 2 there, because I know I have 2 P's here. So there's phenytoin, there's phenobarbital, there's vancomycin, and there's theophylline. And what's the common value for all of them? Usually, the normal therapeutic range should be between 10 to 20 microgram per mil. So that's what my normal level should be for all of these drugs I've grouped together. Remember, your phenytoin, also called Dilantil, is an anti-seizure medication. Your phenobarbital is also used to treat and prevent symptoms of seizures. Status epilepticus. Your vancomycin is an antibiotic for bacterial infection. While our theophylline is a phosphodiesterase inhibitor drug used for respiratory distress, such as your COPD and asthma. So again, you want to remember PVT, where your P is squared, because all of them have the same range, a therapeutic drug range of 10 to 20 microgram per mil. While with our procainamide, or let's say our lithium and digoxin, they actually have not the same range, but one way I need to remember my normal lithium level is because I know lithium is used in producing all of these batteries that are used for cell phones. So again, I know lithium is used to produce these batteries that are used for cell phone. And again, when I think about cell phone, I think about the best network provider in Nigeria, which is Airtel Nigeria. And one of their codes or their numbers usually start with 0, 8, 1, 2. So once anybody has this prefix in their number, you know this is an Airtel line. Again, this is what your normal values for lithium should be, between 0.8 to 1 point. So this will be 1.2. And that's what our normal value should be. So again, remember, lithium is used for batteries that are used for cell phones. And again, cell phone, you think about the Airtel network. Airtel has this prefix of 0812, then the phone number. So again, 0812 is our normal value, 0.8 to 1.2 milliequivalent per liter. And with digoxin, it's actually sold under the brand name Lanoxin. It's a medication used to treat various heart conditions. But again, it has almost the same values like your lithium. So that was why I grouped both of them together. So the only difference is that I just need to take off this 1, and that's my normal value, 0.8 to 2. So again, I always want to group my lithium and my digoxin, so that way I'm able to remember the value. So our digoxin level is 0.8 to 2 nanograms per mil. Again, with our procainamide, gentamicin, carbamazepine was a unifying factor you have for all of this. You just want to remember them with your PGC. So that's why I highlighted the first alphabet. So that almost a way of remembering this, I say some postgraduate courses. So PGC, postgraduate courses. I know some postgraduate courses take between 5 to 10 months to complete. So again, that's my value for my PGC, which is my procainamide, my gentamicin, and my carbamazepine. So these are your therapeutic drug levels for your PGC. Okay, so carbamazepine or our Tigretol is an anticonvulsant medication used for epilepsy, used for neuropathic pain. Gentamicin is an antibiotic used to treat several types of bacterial infection. And your procainamide is an anti-arrhythmic agent used for treatment of cardiac arrhythmias. Again, these are unrelated drugs, but again, the unifying factor is their therapeutic drug level, which should be at 5 to 10 micrograms per liter. And finally, we have amitriptyline, also called Elavil. It's actually a tricyclic antidepressant. Again, I have tri here. It also reminds me this is a tricyclic antidepressant. And again, we have these little tricycles in Nigeria called keke. Again, if you want to take a ride on any of these keke, usually it costs between 100 to 200 naira. So again, that gives me a clue on what my normal range should be. So tri there reminds me of, it's a tricyclic antidepressant. And again, it reminds me of a tricycle, and a trip on this tricycle costs, most times you even see them, you get trips of 150 to 200 naira. So again, this 150, I can also take it down here to give me my value for my salicylates, which is between 150 to 300 milligrams per liter.